Welcome to the Navigating Healthcare Care series. I'm Dr. Charles Page, the best guy to see on the worst day of your life. And my co-host is Dr. Daniel O'Brien. He's a medical futurist, and we're going to be interviewing him today and talking about how to navigate telemedicine, which is a new thing that many of you may not be familiar with. And Dr. Dan is a medical futurist, and he's a specialist in this area with artificial intelligence, telemedicine, and all these things. He's an entrepreneur and has a lot of things on his plate. Dr. Dan, how are you?
Doing great, Dr. Page. Always great to see you.
You know, Dan, you've got so many accolades. I always forget to tell people that you are also the host of the Dr. Dan Show, which is aired every evening, 7 o'clock there in the big state of California. Yes,
7 p.m. Pacific time out of LA. It's going great. We've had celebrity guests on. We've had top leading physicians around the entire world on the Dr. Dan Show. So it's going very well.
Awesome. Awesome. Well, so we're talking about navigating the healthcare series. And so for this first part, this is more Dr. Dan's realm. And so he's going to be giving you about 4 videos. And this is an introduction video for you to kind of get wrap your mind about where we're going with this. You're going to have about 4 other, maybe 5 other videos that you can download where Dan will have a set of actionable steps to take with each video to kind of help you along the process and then kind of guide you along. Is that correct, Dan?
Yes, absolutely. Looking forward to it.
Okay, Dan, so we're going to jump right into this. So here's the first question, and this is a bigger question. Is telemedicine right for you as an individual? And I want you to kind of expound on that. Tell us the importance of having a conversation with your provider about this.
Right. So right now with the key with telemedicine, it's really doing a good job as far as improving access. During this COVID time, we saw such an overwhelming of ERs and clinics and how patients were really supposed to connect with their physicians. So now through telemedicine, you have that virtual chat between a patient as well as a provider. So this is where the importance as far as even follow-up or reevaluation really comes to mind. And I think we're seeing this transformation. Telemedicine has been around for some time, but now during this COVID time, it's really kind of come to fruition as far as improving the access for patients.
One of the funny things, Dr. Dan, is I just got an email from a physician. I have a son who has to have ear, nose, and throat surgery down in Houston, and he's been through several surgeries. And, the question in my mind, kind of being the old dinosaur that I am, well, what about having a doctor to put hands? I mean, how is the doctor going to look up my son's nose? Or are you just going to, here, Charlie, put your nose up to the screen and let's look at it? I mean, how does that work out?
Right. No, that's a great question. And of course, to your first point, I mean, the physician-patient relationship, I mean, that goes back to our medical school trainings. I mean, how important that really is. And I think for this, the initial visit really should be kind of a live visit for any sort of reevaluation or follow-up. But I think right now, as advanced cameras on computers are getting a lot more advanced, we're able to see a lot more as far as by just looking and talking to the patient virtually, being able to kind of help with the diagnosis and further treatment plan.
Absolutely. So, but one of those things, once again, you've got to be able to talk to your physician and be able to decide, do I need to come into the office or do I need to, can we do this online? I'm sure you're going to have a video series that's going to discuss all of those issues. Next question. So Dan, how important is it, the technical question, how important is it to have a good camera, a good internet setup? I mean, how does that work out? And what are the logistics of that?
Yes, Dr. Page, great question. And this is kind of one of the drawbacks as far as the internet connection, as far as the bandwidth. So I would say to all patients, make sure prior to jumping on the call with your provider, you have a great internet connection. There's a lot of bandwidth in regards to that. So that's just very important right now as we look at least from the technology side. And I think this is where having that, again, that up-to-date computer, having up-to-date internet, and even kind of checking with your provider too to make sure, checking with your internet provider that you've got access to this. And it's so crucial because we're hearing that from a lot of, I'd say about 95% of my colleagues, MD colleagues, are utilizing telemedicine. But that one drawback is that internet connection or the bandwidth that people are experiencing.
So for those of us like myself who are still in the flip phone phase of life, you're going to have a PDF of, okay, here's step 1, here's step 2, here's step 3 that people can download, and then they kind of actionable steps they're going to take to be able to get into the 21st century.
Exactly.
Myself, Dan.
You're right. And this is where navigating the healthcare system is so crucial. And if we have that kind of recipe, so to speak, we have that step-by-step guide to help patients with telemedicine, I think we're really going to see the benefit of this healthcare technology moving forward.
So it's just a similar question. This is more of a logistical question, but how do we sign up for a telemedicine account? I mean, do we do that on our own, or do we have to talk to our physician? I'm sure there's multiple different accounts that you could sign up to. So tell us kind of the steps with that.
Yes. So you would partner with your provider. They would kind of find whatever telemedicine, kind of vendor that they're working with. And again, you would be in a great collaboration with your provider, with the staff, with the nursing staff, as well as whatever platform that the physician is utilizing. So it's a very streamlined process. The offices right now, I mean, we're seeing most offices now are really affiliated with telemedicine. If they're not now, they certainly will be in the future, including even some medical school programs. I mean, it goes back to my board exam days where we had to take a USMLE Step 2 CS exam. That's now being utilized as far as telemedicine. So offices now, they're getting very familiar with how to utilize it. And I think with the collaboration within their staff, they're educating the patients on how to do it. So it's a very streamlined, very easy process.
What's amazing is now the technology has really caught up to the concept. So for example, so you're going to set up a telemedicine account with your doctor's office. Who do you talk to? I mean, do you talk to the doctor's office? Do you talk to that specific telemedicine account? Can you give us some hints about that and what that's going to look like?
And you would talk to the doctor's office. You could talk to the office manager. You could talk to, say, Nurse Betty, who is in charge, and they will actually funnel that information to you and make sure that all this it's very easy. The process is set up. And again, then after all, you have an account set up, you would connect then with your physician, with the staff, you would schedule a time. And then again, you would begin this virtual communication, and you'd be well on your way to getting better and at least seeking some sort of help as far as with your condition.
Yeah. Don't forget Miss Betty. Probably not the right person to talk to is the doctor to get the telemedicine account.
Right.
So anyway, so here's another aspect of this, and I'm sure you're going to go into this with another video, but tell us a little bit about copays and payment and how all that works out with telemedicine.
Right. And I think right now there's a lot of course, cost, right? We've always talked about quality of care, cost, access being the three big issues. And I know as far as cost, it really depends on your insurance plan. And I think getting familiar with that, maybe contacting your provider and the staff at the doctor's office can really work with you as far as that. And I know that, knowing physicians and staffs out there, and they know that cost is such a huge deal, but if we can improve access, I think we can keep the copays down. So I think the copays are going to be very reasonable, even though I know that this is kind of newer technology and sometimes it costs a lot. I think during this time of COVID, telemedicine, platforms and vendors certainly understand that we want this out there to be able to help patients. So I really see the copay being a lot less.
Awesome. So I know that you're going to go through this kind of in a stepwise fashion, but what about after the initial telemedicine visit? What are the next steps? Say, for example, your doctor recommends 1, 2, and 3. How do you navigate all that?
Yeah, exactly. So I think going back to, looking at a provider perspective, being able to kind of almost triage, right, into a high, medium, low risk, seeing kind of what the next steps are. And I think this is where educating and, really educating the patient, keeping them aware of what's going on as far as next steps. So really that can include maybe an in-person visit after maybe a reevaluation, after maybe looking at some of the vitals, looking at some of the conditions, say in dermatology, for example, as maybe the dermatologist has seen a picture of a particular mole, or maybe it would look very, cancerous, or even take psychiatry, even telepsych, being able to kind of reevaluate and then revisit what next steps would look like. It could be an in-person visit. Maybe it's a lot more urgent. Maybe it would include maybe an urgent care visit, but at least again, there's some sort of contact between the patient and the provider on kind of a treatment plan and what the next steps look like.
That's good. That kind of gives me a little bit of comfort and assurance thinking about Charlie. I sure don't want to just, for Charlie to do a telemedicine visit and put his nose up to the screen and then schedule him for surgery. So I guess it's going to vary with the kind of pathology or problem that you have. For example, dermatology is perfect for this, or psychiatry is perfect for this. I mean, there's certain, I guess, expertises that are going to be even, better suited for, telemedicine visits than in-person visits.
Yes, absolutely. I mean, if we look at those two specialties, I mean, particularly right now, with COVID, we've seen such an increase in anxiety and depression. And I think this is where telepsych certainly is, playing a crucial role. And, in dermatology, we've seen an increase in skin cancer. One of the number one skin cancers around, are one of the biggest cancers around is being skin. If we look at geographically different areas around the country. And I think if we can get people assistance, get people treatment, increase this access, it's just so important right now.
Mm. So that's great. So those are, some great questions to start on. So Dan, tell us what's next. I mean, as far as the videos and kind of what, our viewers are going to see and kind of where we're going from here with this navigating telemedicine in our series.
Yes, I think just kind of walking through some of the steps, where we can kind of help the patients, maybe some sort of challenges that they're facing. I think that's really, certainly crucial. And talking about what technology can do as far as quality of care, cost, and even in some of these rural areas as we're kind of increasing access that some people are not getting to. So those are kind of the next steps in regards to, telemedicine. It's certainly an exciting time right now. We've seen this digital transformation because of COVID, and we're in this new era of healthcare. And I think telemedicine is a wonderful part of it.
Right. So for those of you who are listening, who have joined in on our Navigating Healthcare System series, this is just the introduction. If you'll click on the next video, Dan, Dr. Dan is going to take you through all these next steps of how to set things up and how to kind of take the next steps down this process. I'll tell you, even for me, I'm a doctor, and of course I'm technically challenged. I'm kind of a dinosaur, but it's kind of overwhelming sometimes to think about all of these things, and it's just such a different paradigm, even for me as a doctor to move through. And so I'm actually excited about watching these videos myself, and I'm sure there's a lot of things that I'm going to learn that from the other side that actually will make me a better physician and maybe make me more comfortable with Charlie as we go through this process. So, Dr. Dan, are there any final thoughts?
Right. I think right now, just be able to be open-minded to technology. I know before, Dr. Page, you were saying you're kind of a dinosaur, right? For those out there, as far as technology, I mean, it is here to stay. We're seeing this new era of healthcare. I know there may be some challenges at first, but at least, again, being able to increase the quality of care and the access right now is so important right now in healthcare, and really be open to telemedicine, because again, as we're seeing an overwhelming of ERs, of clinics because of COVID, I think it's a great, safe technology.
Awesome. So this is Dr. Daniel O'Brien, medical futurist and host of the Dr. Dan Show, and I'm Dr. Page, the best guy to see on the worst day of your life. Welcome to the Navigating Healthcare System series, and we're going to be first discussing telemedicine. So you can click below in the next video and we'll get going. Thank you very much.
Great. Thank you.